Hello everyone. Today I would be presenting to you the topic regarding how do you prevent diabetes. Hi everyone, I am Dr. Yasin from Trivandrum, India, and I am a fellow of diabetology. When you look at the classification of diabetes, you would see there is a lot of different type of diabetes. There is your type 1, type 2, your gestational diabetes, and there are a lot of other type of special type of diabetes. So, how do you basically get diabetes? Either you are not following a proper diet, you are eating too much, you're gaining too much weight. Obesity is one of the most important reasons for diabetes. And obviously, there is a lack of physical activity. Your body is consuming more calorie than it can spend. Sometimes you inherit it, and some cases it's idiopathic, which means we don't know what the reason is. It's sheer bad luck. Some type of type 1 diabetic is said to be idiopathic, but most type 1 diabetic are followed by a viral infection where the body reacts against the virus and also against your beta cells, damaging it, causing type 1 diabetes. So who is prone for diabetes? So when you look at your general population, majority of these people would inherit the disease, would catch the disease at an age which is more than 45 years of age, where the risk starts increasing. So the guidelines generally say that scan or um, assess these people who are more than 45 years, check their blood glucose levels and see if they have diabetes. If you have a family history of CVD or type 2 diabetes in your family, that is something you have to look at. Overweight, obesity, sedentary lifestyle, and in some ethnic and racial groups, they are more prone to diabetes. For example, you have the comparison between the Asian and the Caucasian population, where the Asian population are known to have more visceral fat inside them. And this is a risk factor for diabetes, and hence they are more prone to diabetes than the Caucasian population. You can always do something which is called a risk calculator, and this is a risk which is done for myself, and I was shown to have low risk for diabetes. But you can always go to this site of the ADA site, American Diabetic Association site, and you can put in your risk factors. They have certain questions. You answer the questions and they will show you how much risk do you have in diabetes. I will put the link of that below and you can take it from there. So how and what should you eat? Diet is a very complex topic and it's a very controversial topic as well. Diet, to be simple, there are a lot of different types of diet: keto diet, low fat diet, high fat diet, low carb diet, high carb diet. But I would just say go into a basic Mediterranean type of diet with more amount of vegetables in your diet. That would be better. It should be well balanced. You should have all the calories you need, and you should make sure you're not consuming too much calories. And you can't say this diet is better. Some people say keto diet is more better than other kind of diets for diabetes. But if you look at longevity of life, the most important thing is you have to have a balanced and proper diet. Not one or more should be other. So if you, for example, if you look at the Okinawans from Japan, they have a very high number of centurions, those people who've lived more than 100 years of age. That's because they have a balanced diet, and it is believed that they have a balanced diet, and that is what is the cause of their longevity of life. And coming to exercise, your all your guidelines, your diabetic guidelines, suggest that you do 30 minutes of a brisk walk every day, and that would be enough to register as an exercise in your body. You have to do it daily or 5 days at least a week, and make sure your exercise is not too vigorous that it might injure you, and it is not too less that it is not enough. So make sure you wear a good pair of shoes while you're jogging or running, or you don't have to run, you can do a brisk walk. And if you're using a treadmill, for example, mostly people prefer treadmills now because of the corona pandemic, and you don't want to go outside. Use a proper and good treadmill. Don't buy the cheap ones, and that might injure your knees. Some supplements like vitamin D supplements have been put under study for prevention of diabetes, and it is said that enough vitamin D in your body is good to prevent diabetes. You can take supplements of vitamin D, also vitamin B, C, E, and zinc would be helpful. Make sure it's there in your diet. If it's not there, you can always take the supplements after consulting with your healthcare provider. And what should you do? You should just eat healthy, have a balanced diet, do your exercises, make sure you have no deficiency for any vitamins, consult with your doctor once in a while, go for a routine follow-up check, a health checkup, and make sure you are not at risk. And if at all there is a beginning stage of diabetes, obviously your doctor can help you to reverse that factor. He can make you back into a non-diabetic person. And always do not smoke or drink. That is my advice. Reversal of diabetes, yes, it's possible. Studies have been done, especially Diabetes UK have shown that in obese people, by reducing 15% of their body weight, they were able to bring back the sugar levels to normal levels. And we have a lot of studies with other drugs, for example, like GLP-1 analogs, that have shown to bring back diabetic people to a non-diabetic state. I'm saying this is very important. There is a reversal is happening, but it is not the exact cure. It is like you're going back to a normal state. You can always go back to being a diabetic again if you're not careful. And reversal of diabetes is possible in most cases, but it is not possible in some cases, like your type 1 diabetes and some other type of diabetes. So you have to talk to your healthcare provider regarding these things. Eventually, some people who can't do the dieting, who is not able to reduce the weight, they can benefit from bariatric surgery. Bariatric surgery is a surgery, so most people are very scared of it, but the mortality rate in bariatric surgery is very less, about 0.7%, and the risks are quite less now, and there are a lot of laparoscopic procedures available. So the technologies have improved a lot, and bariatric surgery can help in those people who are morbidly obese and cannot do a diet or are not being able to reduce their weight by dieting. They can go for something like bariatric surgery, where there is absolutely a large number of patients going back into normal or remittance of diabetes after bariatric surgery. So that would be it for from me today. I would suggest, if you're worried about diabetes, go to your healthcare provider and check your HbA1c level. HbA1c level is a better tool at diagnosing most kind of diabetes, like type 2 diabetes. So, and that would be it. And if you have any questions or queries, you can always put them in the comment below, and I would be happy to answer. Thank you all.